in very recent times the success that has been achieved in the control of infectious diseases through vaccination has led to a situation where perceived risks from many infections are terribly low. Why? Because these infections do not circulate anymore. And therefore it happens that in this moment we are facing a quite particular situation in industrialized countries due to the fact that infectious diseases are circulated so little due to sustained vaccination programs in the past, in the last decades. Perceived risk from the infection itself are terribly low, while on the other hand, for all vaccination we know that there is a low but always positive risk of getting some side effects, some vaccine adverse events. And therefore this, raises a problem of conflict between, two different rationalities. On the one hand, the public rationality. The public rationality wants that we vaccinate as much as we can in order to remove the infection from the population and therefore to protect everybody due to the fact that the virus circulation has been interrupted. But on the other hand, at the level of the single individual, there is a completely different rationality. This rationality has no interest for the population, for the community as a whole, but just for my children, for my child that needs to be vaccinated and which in the current situation has to face a positive risk of getting an adverse event from the vaccine compared to a risk of getting something from the infection which is perceived as about zero. Zero. Why? Because in fact most infections are not circulating at all. And this really creates some sort of conflict between two different rationalities which can potentially damage our, vaccination programs because there is a risk that people escape from vaccination.